we'll start with our numbers that we typically do. So this week from the 18th through the 25th, you can see the active cases in Clay County.
Is your mic?
Oh, I'm sorry. I'm probably not too far away.
There you go.
Is that better?
Yes, that's
Okay.
better.
So the active cases in Clay County from October 18th, they were 368, and they went down just a bit to 312. If we look back in Clay County, the first 2 weeks of October, we went up. The first part of September, we went up, and then the end of the September, it went down. First part of October went up. So we can see that the cases are fluctuating in the last couple of months. You see the active cases in Minnesota did go down as well. Now, if you look on the other side of the river in Cass County, they actually went up again. In September, their cases were up. Then the first 2 weeks in October, their cases went down, and now they've jumped up a little bit. So that's the reality of when you're looking at active cases. They may go up and down. We're looking to hopefully continue a downward trend in Clay County. The active cases in North Dakota, we also can see that they decreased a bit as well. And then the active cases by age, and again, we've talked about the lower age groups that we're seeing cases in, and it's distributed amongst those age groups. About a third of the active cases are under 19 years old, so we're still seeing elevated numbers in the school age. And then we look at the cumulative cases by age. Our total case count is 10,346. So this is across the pandemic total number of cases, which now is over the 10,000 mark. And then this slide is the cases per week, starting July through current. So we're seeing again that upward trend since about August, and then I talked about where they're kind of up and down. So it's still too early to tell yet if we've reached that peak and are now on the downward trend. So that's kind of what we're watching for this fourth wave. And this is the cases per week. So this is just the overview, as you can see, of all the cases. When the first part of this is back in March of 2020. So we look at where some of the peaks have been. And I think Jamie will follow up from here.
Okay, looking at the Clay County deaths per week, unfortunately, we did receive notification of another death. So we're at 99 for Clay County. And then the next slide, looking at the hospitalizations this week. We've had 5 admissions reported for this last week so far. Things have kind of stabilized a little bit there. We're seeing 5 each week. And on the next slide here, this slide breaks down the recent hospitalizations for Clay County residents by age. And you can see that the majority of the hospital admissions have been in that 0 to 64 years, 64% of them. And then also the breakdown of the hospitalizations by age from August to the current time frame. Total of 72 admissions since August 1st in Clay County. And then looking at the hospital beds available, this is just our Fargo hospital capacity for each of Essentia, Sanford, and the VA hospital. Hospital capacity, our local healthcare systems in Fargo. The total statewide ICU beds available statewide are 17 adult beds and 5 pediatric beds. And again, note that each of these are referencing staffed beds. So they are continuing to stress the fact that staffed beds versus total beds available is their challenge. And then we have the North Dakota hospitalization data on the next slide. Currently, there are 173 hospitalized in North Dakota. Of those, non-ICU are 155, and then ICU 18. And then you see the cumulative numbers, and then also the current hospitalized due to COVID by age in the breakdown of that. And then the cumulative hospitalized due to COVID by age, as well as the current there. The chart in the middle shows the current hospitalization broken down, currently 1 pediatric admission. And the next slide, this is the Sanford, the 22 Sanford Health-owned hospitals that we've been showing. And again, what we're trying to depict with this slide is that 198 of the 219 are unvaccinated versus the 21 vaccinated. So we sound like a broken record, but really trying to state that the vaccinations continue to keep people out of the hospital and out of the ICU for most cases. And then breakthrough cases, basically over 3 million Minnesotans are fully vaccinated at this point. We continue to see strong protection from severe illness and death, but we continue to highlight that there is breakthrough cases in Minnesota. So total is 1.441% for breakthrough cases in Minnesota, breakthrough hospitalizations 0.085%, and breakthrough deaths 0.008%.
I want to comment on that again. I just saw on the national news last night they were talking about Pfizer or Moderna or whatever, and they were talking about the effectiveness is 91% now or something like that. And I think before they were talking 95 maybe. The fact of the matter is we've known all along that the vaccine probably won't work for everybody. And for us to have a breakthrough rate of 1.44 is indicative that it's probably working better than what was anticipated. And once we start to hear about breakthrough cases, all of a sudden, the impression is that these vaccines aren't working. And to me, the evidence is the opposite, that when you see that kind of a rate, it's even more effective than what they talked about. So I just want to bring that point out for the public to,
Very good.
when they're deciding if they want to get vaccinated or not. So.
What number are we looking for? I mean, we've got a mask mandate now. What number are we looking for to take that mandate off?
Yeah, well, we're looking at like the initial case count and the count throughout Minnesota and North Dakota. We're looking at the trending down. Those waves of the pandemic, and we're in the fourth wave, we often see kind of a decrease at the end of the wave where we're trending down. That's what we're looking for, and we talked with epidemiologists yesterday in regards to that. So hopefully this is our trend down. We don't know that for sure because a trend is not just the one-time reporting of those. We also look at the hospitalizations that Jamie just reported on, and specifically our hospitals in Fargo are the hospitals that really serve our community. So we want to ensure that, their capacity, as Jamie mentioned, is based on their staffing. It's not just COVID in those hospitals, it's all the other emergencies and all the other things that they're dealing with. So we're really looking at what's the capacity for them. We certainly don't want them to be beyond capacity and needing to ship people out. So we look at that as well. Our Minnesota hospitals still haven't seen a decline yet. We also are tracking the hospitals that are surrounding us in Minnesota, and those we're not seeing a decline. So we're looking at all of those figures across mostly our metro area, but also in Minnesota, and then we're tracking North Dakota just because we're kind of one metro area. So we're looking at all of that, and then depending on our epidemiology experts to kind of vet out all of that information. So we follow what MDH is requesting of us.
If we're taking all those other things into consideration, what's the mask got to do with it? We have a lot of people with heart problems or a lot of people with something else. What's the mask got to do with it then?
Well, the masks protect even those, if you're fully vaccinated, you can still carry the virus, and you can still spread it. So the vaccine protects you from getting severely ill or hospitalized, but we're also protecting all of those that aren't vaccinated. And we have people coming into our buildings, so we have people coming into the DMV, to the government center, to our building. So we really want them to be masked because we don't know oftentimes of their status. And so, and the court systems and the law enforcement center, so masking makes sense because we have a lot of traffic that comes into all of our buildings. Now, we can't control what's outside of our county. We don't control there's no emergency declaration, so we can't decide what businesses will do, but we can at least do the preventative measures for our county. And this is pretty consistent, so Fargo did their mask mandate, the city of Fargo and all of their buildings, a bit before we implemented that, and again, their numbers were a little bit worse than ours as well. So it's just a mitigation strategy. It's one of the, the social distancing, masking. So again, we have people unvaccinated. We have a lot of children unvaccinated, and so we have parents that have children. So we're just trying to mitigate that in what we can control. Did that answer your question, Commissioner Gross?
Yeah. Yeah, I guess I don't know. One place has it, one place doesn't, and it's just, I mean, you come in here, you wear a mask. You go up to the next door, you don't wear a mask, and I don't know.
Yeah.
I guess we're doing our part, so.
We're doing our part. Exactly right. Thank you.
Okay, so then to continue with the slides here, the next slide shows the statewide data for the first and second doses for those 12 and over. So people with at least one vaccine dose, we're at 73.4%, and we're crawling with those first and second doses, and people who've completed the vaccine series at 69.9%, and we were at 69.6%. And then you'll see the breakdown of those by age group. Last week, the 12 to 15-year-olds had one dose, 54%, now we're at 58%. And they 49% last week, and now we're at 53%. And 16 to 17-year-olds was 60 last week, now we're at 63, and 56% had completed the series, and now we're at 59. So Minnesota is trying to get those 12 and through 17 vaccinated, and so there are campaigns out there right now to encourage that be done by November 30th so they can start to push towards the next lower age group for vaccinations. And then I'll flip over to the doses administered by Clay County Public Health, 15,738. You can see this last week, we just hit 41. We gave 5 doses of Johnson & Johnson. We always have that as an option as our clinics. And then we reach out to corrections and the homeless shelters to try to fill up that bottle. So we've been successful in that each week using the 5 doses in that bottle. We gave just 1. Minnesota Department of Health is continuing to push local public health to prioritize first and second doses. There are lots of opportunities for boosters in the community through pharmacies and healthcare providers, and so they want us to continue to focus on first and second. So we keep offering them. Yep.
On that a little bit. So I understand that Minnesota Department of Health might be giving you guidelines. I really do struggle with the fact that they're dictating your ability to give those boosters when we're only giving 41 doses in a week. And I'm not trying to minimize what you're doing. You've done a phenomenal job as can see. But, I know of several different instances where they were all set to go to your vaccination clinic today and it wouldn't work out because of the booster, availability. And so then they're going to, if we have the vaccine, why in the heck can we not give it? It just seems like we're, and maybe I'm putting the soapbox out, but it just seems like we're trying to do all these strategies to mitigate and the masking and the social distancing, and we want people to vaccinate. But, oh, by the way, we have it, but we're not going to give it to you because we're trying to prioritize when we're only getting 41 doses. Does that seem odd?
So I do want to be clear that each of the clinic weeks we are offering the Pfizer boosters. And so we did give just 35, even though we have it available. And that is the Pfizer. So we have not been given permission to move to the next phase of Moderna and Johnson & Johnson.
But why? Because Thrifty drug is.
yeah, well-
Drugstores are, why not?
Right, and Mr. Chair and Commissioner Mojo, we're waiting on protocols. So Minnesota Department of Health has not, they've not distributed our protocols, so we have to follow protocols. The pharmacies do not. We do, because we're under the Minnesota Department of
Is that odd
Health.
to anybody?
Yep. So they will get us protocols soon. I requested those yesterday because we're waiting on that. We can give the vaccine when we get the protocols. And our protocols in all public health across the state must be signed by the medical director. And so as soon as we get those, I'll get them to our medical director, we'll get those signed, and then we can start vaccines. But again, we're waiting on MDH. Pharmacies are part of a federal system, so they don't have to wait on MDH. So that's the delay. We hope to get those protocols this week. I'm pushing to get those, as are other counties across the state. That's the delay.
And
Go ahead.
And I just, if we are saying we're doing whatever we can to mitigate this, and if they're telling us it's as serious as it is, why is this taking so long? And I get there's some, we're all getting tired of this and we're trying to help this, but we've sat in meetings and meetings and meetings for hours trying to figure out how to limit this. And if it boils down to the need for the vaccine and the boosters are an incredibly important part of that, what is the holdup?
Well, and the authorization, I'm sorry, Commissioner Mojo, the authorization, of course, just happened, and unfortunately, when it happens at the federal level, it's like, okay, everybody can get their vaccine. That's true for the pharmacies, but again, MDH will take a few days to get those protocols out. And as Jamie reported, we are giving Pfizer boosters, so anyone can come to our clinics. We're sending out the messages of those that received their primary and secondary dose of or the primary series, of Pfizer, and so they can come for boosters at any of our clinics, and we advertise those. We've sent them out to various, those that we have on record. So we are getting those out to as many as we can. So we're waiting on the Moderna and the J&J booster documents, and so, again, I'll push again today, if we haven't received those, to get those protocols, because then our process is to get them to our medical director and get those signed. Once the medical director signs those, then we can start with those boosters.
I want to point out, I echo the frustration, for the exact reasons that Commissioner Mojo talked about. On the other hand, their Moderna, I believe, was just federally approved for the booster last week.
Correct.
So it's not like that we've been waiting a long, long time. I do want to let the public know that there is availability. Myself and a couple of friends, we managed to contact Walgreens and Moorhead on Main Avenue, and we had an appointment for 10:30 Sunday morning, and went in and got our booster shot. So it's available. Unfortunately, the protocol from your system for public health for Moderna and Johnson & Johnson hasn't happened yet. I don't even know if the FDA has approved Johnson & Johnson for the booster yet. I'm not sure if they have.
I believe so. I believe that was Thursday as well.
Yeah.
Okay. So, but just, if the people are really, and I do have one question on the booster in a minute, but if people are really interested and concerned about and want the booster now, they can contact their own pharmacy.
Correct.
There is a questionnaire, and there are limitations on who qualifies right now, even at those locations for the booster.
Right.
In other words, it can't be anybody. They have a priority process that's in place. I happen to fit in based on my age.
Yeah.
So anyway, so my question on the booster, maybe, Jamie, for you, and maybe you can't answer this today, but in the past, when you'd go in for your first shot and your second shot, they'd say, well, it's not going to be fully effective till 14 days after, I think it was. In the case of the booster, is it the same thing? Is it before it's fully effective as becoming a booster? Is it that 14 days after? Don't they know that yet?
With your first and second dose, you're fully vaccinated already.
Right.
So it is really a booster. And then what they found with the first and second dose is it takes about 2 weeks for that to kick in. But you are already fully.
And then the booster just increases your
Exactly.
immunity
Correct.
Exactly.
percentage or whatever.
That's correct, yes.
Yes. Yes, Commissioner Ebinger.
Yeah, not to be redundant, but my wife had her Pfizer several weeks ago when it was authorized, but I went in Friday and at Walgreens, and it was every 15 minutes they had people in there. You know, again, I qualified because I'm over 65, and there's some qualifiers in there, but what Clay County Public Health is going through is part of the government bureaucracy. I don't like it either. And I wish we could be more helpful at a county level. But the pharmacies are fully wide open and operating, and if you meet the categories, they can get a booster now. They've got them, and it took me from picking up the phone to walking out with the Band-Aid on my arm, probably an hour and a half. And most of that time was just sitting home waiting until my appointment time came up. So it's a fairly painless process, and really encourage people to do it. And if they haven't gotten their first or second one yet, please do it. And we're able to, at the county level, to administer those at our vaccine times, but the pharmacies are doing it, and the healthcare providers are doing it also.
And Mr. Chair and Commissioner Ebinger, we anticipate getting our protocols very soon. I don't think the delay will be weeks. And so we should get those soon, and then we'll be able to offer those booster doses, again, along with our Pfizer that we're already offering, so.
Jamie, do you have more?
No, I will just add, just as an explanation for that, is what the protocols are is it's actually a Board of Nursing requirement, because public health is an independent practice, so it's not a doctor's order. So it's actually created with, who qualifies, what the precautions are, when what the contraindications are. It's several pages that the Minnesota Department of Health puts those together for local public health, and then it goes to our medical director for review. And we did actually, because we were waiting for the Pfizer, we started working on that ourselves in order to create it as quickly as we could, and we'll do the same thing for the Moderna and Johnson & Johnson.
Yes, Commissioner Kaylee.
So have you heard a timeline about kids under 12 getting shots and when that's gonna projected to be approved?
Yeah, the kids under 12, the 5 to 11-year-olds, yeah, they're,
Not officially, but
Right.
officially towards the end of November is what they're looking at.
yeah, they're still in the process of getting through all of that information, so.
Commissioner Mojo.
Thank you. Are individuals available or allowed to get their flu shot at your vaccination clinic?
Yes.
Okay. Sorry, I have a frog all of a sudden. And also, I had inquired a couple weeks ago about doing off-site vaccination clinics, either at the DMV or elsewhere. I was at a football game in North Dakota yesterday, and they had a vaccination site at the football game. What are you hearing or planning in terms of that?
Yeah, we've, Commissioner Mojo and Mr. Chair, we've had Josh checking on various sites to see if there's locations. In fact, he made numerous numbers of phone calls to businesses where people, go. That would be great if we could go to a business where there's constant flow of citizens, but we didn't have any success in getting into those locations. So we're still looking where the DMV is in the Center Mall. The numbers are low. We have people coming to the DMV, but there's not a lot of high traffic. So we were hoping to get some of the areas where there would be a lot more traffic. So he's still working on that process. So.
I appreciate that. I think that, it's maybe not always about huge numbers, particularly since we only saw 40 vaccinations total last week. So I appreciate that you're looking at that, and however that will look, I think it's important to be able to go to the people, because it is sometimes a limitation to have to go online, schedule an appointment, figure through that. I was trying to help my mom with that last week, and she's, why can't I just walk in? And so however we can continue to make it as accessible as possible for people is important.
And Mr. Chair and Commissioner Mojo, we also tell people if they're struggling with that online form to just come to our clinic and we'll help get them registered.
Commissioner Keeley.
Thank you, Mr. Chair. One last thing, I saw this wonderful email from Public Health come out on this week saying that, yes, the rapid testing is available at the Vault Clinic. So do you want to just mention that a little bit?
Sure. Yeah, the state had approved that we could have rapid testing along with the saliva testing. So it's at the same Vault testing site. The hours are the same, and we have those posted on our website. We did send those out to all the cities, schools, higher ed, so they would know when the testing site is open. It's Monday through Thursday. They're not open on Friday and Saturday, and then they're open on Sunday. And the hours vary on the weekend. I think it's 10 to 4 and 11 to 6 during the week. So there's an ability to get a rapid test there, which is a swab, and then the PCR test that they've been providing all along is the saliva test, and that is open to Minnesota and North Dakota residents, because the North Dakota testing site has accommodated Minnesota residents for quite some time who were looking for rapid testing. So that is open and available, so people can go there to get their testing done. Thanks for reminding us of that.
Okay, Commissioner Mojo.
A month ago, this board made a motion to enact the mask mandate on the county campus and as well as their buildings. And we did that because it was a response to some trends that we'd seen in the community. I was critical of that because I was concerned that we didn't have a policy in place or benchmarks in place to really have a guiding document for what it will look like going forward. I don't believe we have that yet. I know we're going under your recommendations, and I honor your work and your stance and respect you on that. You know, in researching this week, I've done a lot of looking at trends. I understand the hospital trends, local trends, our communities next door. I've spoken with commissioners from several different community or counties neighboring us on what they're seeing. I've followed the Moorhead School District's percentages. The student percentages are at 0.48%. The staff is like 0.38% positivity, but also quarantine ratios. The Holly School District has 3 out. My point is I've been very, very careful to make sure that we're looking at all of the parameters, and in doing so to look at what county buildings policies should be. You know, I'm concerned because our Clay County staff, personally, our percentages have been quite low for positivity, but also quarantine rate. We're less than 1.5%. That's been steady. We've tracked that all the way through. I've had significant conversations with Darren on that. I also serve on the ARPA committee, and when we voted on this a month ago, I said, I want departments to come to us and say, what more can be done? Here's some money that is out there. We need this in our department to keep people safe. We need this in our department to help streamline so that we can reduce contact. And we haven't had any of that. You know, I know it's an unpopular thing. I have not been quiet about the importance of vaccination. I've been vaccinated. I marched my kids through there. I'm doing all that I can to help limit my exposure. But it's concerning, and because of that, I will make a motion to cease the mask mandate in our public buildings and county spaces, effective today.
I guess that's what my original question was, say, when I came, what are the benchmarks, and I will second that motion.
Okay, we have a motion by Commissioner Mojo, second by Commissioner Gross. Discussion. I have some questions, and I was going to actually raise these before this motion was made. When I look at the Clay County cases per week on the handout today, these numbers are significantly higher than they were in April of this year. Was it in May of this year when all of the state mandated issues went away? Am I correct in
Remember that?
Yeah, for the
the emergency
Emergency
executive order where all of these things were in place? Was that May?
I believe that was May. I can't confirm that. I don't have that right in front of me.
Yeah, and so when you look in May, we had numbers, Clay County cases in the 50 to 60 range, and then it obviously went down to as low as 3
Yep.
in July. We're at 165 this week. That's still probably 3 times higher than, if I'm correct in thinking when the executive order went off and what we were doing. I would like to see us have some sort of a specific, getting to Commissioner Mojo's early question, is that what can we have as evidence to know when this can come off? I'm not positive that it's today. I know I've also heard from some county employees who are comfortable still with the mask, and I've also heard some that aren't. So it's just one of those things. We're damned if we do, damned if we don't here as a board. That's just the way it is, but that's why we get paid the big money. But having said that, what's the criteria? Just simply because we haven't gotten anything in place right now, I don't know that that's enough to remove it. But I want some clear evidence as to, if the numbers in Clay County, for example, go down to 60, I would think that in the same regard, the same thing would be happening across the river. As Commissioner Gross said, we're all one community. You might have people wearing masks in one place and not the other. So those types of things are happening, and I want this mask thing off as soon as possible. But like I said before, I depend on the experts in this to guide me in my direction when it comes to this. I don't want anybody. It's 1 year ago this week that I experienced something really bad as a result of COVID. And I'll do whatever I can to prevent anybody else from experiencing that. So I just point that out as part of this discussion.
And Mr. Chair, if I can, again, I know there, there's maybe a need to have a specific number. That's just not how a pandemic and viruses work. So the best we can do, because it's unpredictable. You see the numbers go up, you see the numbers go down. And so we have to follow the case count. Again, we're looking for a trend. So we're looking really at what is the trend? What are we seeing? Are we seeing decline in the number of cases across Minnesota, across Clay County, and again, hospitalization? So what we're reporting on is really what we're looking at. We can't tell you that at 100, we're looking at what's the trend going to be, and a trend is a few weeks of decline. We're expecting that. That's where we're at in this fourth wave. And, our recommendations are based on epidemiologists who actually, this is their forte, this is their expertise, this is what they study. So we are just following what our epidemiologists, both internal and throughout the MDH. So again, we're trying to just follow what public health should be doing. It's the vaccinations, it's all the mitigation factors. So, we're doing what we're supposed to. And we are getting accolades across the region because in this board, what I've heard from my regional partners is they're impressed that this board implemented a mandate, because that's what their boards, they wanted to have happen, and it didn't in some of our neighboring counties. So this board is getting accolades for, making that policy internally. So that's just, I know it's not a hard and fast number, unfortunately, because it is a virus. So this is the best information we provide every week that we can give you.
Commissioner Erbinger.
Yeah, I too am sick of masks and don't like them. But I'm not going to argue that they have an effect. I think West Fargo schools found that out. They've implemented mask mandates in one of their schools where COVID is out of control. Granted, a school is a different environment with the number of people that can't be immunized and the proximity and a number of other things, but it's been controversial for our school boards, and Fargo and Moorhead have stepped up and implemented them because it's good for the students and good for the staff. This is not as critical, I think, with the county, but it still is critical. I've had feedback from employees, particularly employees with kids, that appreciate that we have a mask mandate. I want it to come off as soon as possible, but Ms. McKay, we are counting on you to give us your input on when you think that's happening, and I'm not hearing it right now. So I choose to err on the side of caution as far as this goes. Thanks.
Mr.
Chair,
Keeley.
excuse me.
No.
Yes. Can I add one comment?
Sure.
One thing we've talked about before is that really our primary focus is on hospital surge. And so we did have a meeting with healthcare providers last week, and one of the comments from our healthcare professionals was that they're starting to see a plateau in the hospitals on the North Dakota side. And I think that's a key piece for us in public health. And then also that they were continuing to see high numbers and a need for transfers on the Minnesota side. So I think that says a lot to us, is hospital capacity and the surge, and the pressure is still on the Minnesota side. So that was one of the things that we talked about, Kathy and I talked about with our team, was that hospital surge.
Okay, thank you. Commissioner Keeley.
So we just had one more death reported, and I'm looking at the number of 99, and I do not want that to become a 3-digit number. And even though this is a small thing, it's just in county-owned buildings, there are so many people that come in, and it's not necessarily when they're meeting with somebody in the Family Service Center or whatever in those spaces, but the lobbies, the hallways, the meeting rooms, I see those as the more high-risk areas. And so this is our tiny piece that we can do to stand up for the protection of the health of our community. Let's not get to 100. Thank you.
I want to talk internally for a minute here, and I'm going to kind of look back at Darren here, and I don't know what our policies are right now, but I would certainly hope that internally, if we have our employees who are sick, stay home. I mean, I can't give a clearer message from my standpoint on that. If you're sick, stay home. Get tested and find out then if you're, I know there are some who might be low on vacation time or sick time or whatever, but the risk to others on something like this is way too severe. I am not going to support the motion today, but we've asked, once this spike started happening, or these wave happened, we started having you come back every week. I noticed Becky isn't here today, and she's our epidemiologist on our part. I want her back here, and to have these discussions. And when you talk, Kathy, when you're talking about trending, it seems to me now we've had a 2-week trend that it seems to be the numbers have been dropping, and I want to, hopefully that continues, and within the next week or 2 weeks or 3 weeks, we can remove this mask mandate. I'm not gonna vote for it today because I don't know that anything's changed from this week to last week, other than we're down maybe 50 cases in the county, whatever that number is, but I'm not gonna, I want some evidence that we can do this. And if the trending is what it is, the numbers are the numbers. And I know the hospitalization thing sometimes falls, it lags a little bit in terms of the rest of it, so. Okay, Commissioner Mojo.
Just to follow up, I don't think I ever said that if things got out of control, that I didn't support measures to make sure that we helped with that. Currently, we have 3 staff that are out sick or quarantined. 3. I understand where your perspective is, but we're continuing to go along without having policy. And a month ago, I asked for policy, and now we're just going to keep going without policy. Let's look at staff vaccination percentages, staff sickness percentages. What's, the hospital capacity the hospital capacity that Sanford is seeing right now, what percentage of that is what it used to be in November when we really saw huge surges? Is Sanford currently having traveling nurses come in to help like they did before with their surge? I understand what we're saying, we need to help the hospitals, but I also want to make sure that the hospital is doing everything they can to be prepared for surges, and I've not seen that. So.
I guess I would have one more comment. You mentioned that you haven't seen that number yet or whatever that changed your mind, but my question, what is the number?
Right.
What are we looking for? Are we looking for 20, 30, 40? And I guess that's what I'm trying to find. What is the number I'm looking for before I say, boy, we better wear those masks all the time, and whether we're 6 feet apart or whatever. If you're in the building, you wear a mask. But what's the number?
Commissioner Gross, that's why I was referring back to when the state executive order went off, because there were numbers available at that time, and there were also numbers that were attributed to Clay County. And so I would think if we can go back and have that as our somewhat of a guideline, at least from Clay County's standpoint, it did have numbers attached to it.
Makes sense to me.
So, and that's kind of what I'm referring to, and what I'm seeing right now is our numbers aren't quite there. But again, I'm not 100% sure in my own recollection as to when that went off, if it was April or whether it was May. So, so we'd have to have some, maybe looking at that. But I do agree that we have to have something now. What the things that Commissioner Mojo just talked about, all of these different sequences. Okay, these are things we need to measure. I'm assuming you're doing that for us. That's my assumption, is that you're doing that, our epidemiologist is doing that. But I think we're all kind of somewhat in limbo here is, what is the satisfactory numbers? That's what we're looking for. Can somebody help us? Could we have some idea next week of what these numbers should look like?
Commissioner Chair, as I mentioned, because it's a virus, and back when the executive order, they were looking at trends. It's always about trends with the virus. You can't say at 60. Part of what you're requesting is kind of an impossibility, and we've had multiple conversations with our epidemiologists who say, this is exactly what we can give you. And then when we see the trends, and the hospitalizations and in all of the combination of that. And I understand wanting a specific number, that's just not going to be possible. When we look at the numbers of people vaccinated internally in our county, that's just one segment, because we have many, many of the public coming in to all of the county buildings. And so we have to take into account, we don't know all the people that are entering our building and what their status is. So, we need to take into account, we don't work in a closed, locked building. it's open to the public in all of the county buildings. So, you know, we take into account that we have people coming and going. We're requiring masks for people that come and go. That's part of that mitigation strategy as well. So we need to actually, if we're going to require masks of the public to come into our building, it's prudent for us to, you know, be masked.
Kathy, I would just put, at our peak here, in this most recent wave, we were at, let's put these on, 256. And we've gone to 217, now we're down to 165. And if we went down to 100 and then to 60, wouldn't that be a trend?
So are you looking at,
I'm looking at cases per week in Clay County.
the active cases? Yeah.
Well, I am assuming they're active cases.
Oh, you're not looking at the active cases, okay. Yeah, we're, you know, as you look at the active cases, what we're seeing as, you know, it was 312 this week, was 368 last week.
Yes,
That's the first one.
okay.
So yes, we did dip like 50 people in Clay County.
Yeah, and if that keeps going down, that would be
Correct,
great.
yeah,
Okay, all
that's
right.
the trend, yep.
All right. Any further discussion on the motion? Roll call vote, please.
Commissioner Kaylee?
No.
Commissioner Gross?
Yes, excuse me.
Commissioner Mojo?
Yes.
Commissioner Campbell?
No.
Commissioner Ebbinger?
No.
Motion fails. Again, this is, you can see how there's a lot of uncomfort in this, and we need, that's why we want you back here every week, and if we can have Becky back to, and we can keep trying to get answers to these questions. And I want this mask mandate gone as much as anybody does.
Probably not as much as public health wants it.
True.
We
take a lot
definitely
more
get
brunt than we
all
do.
of the, we get all the information of
We've been
Good and bad.
way over on this, but anybody want to talk about this, or are we good?
Yeah, it shows how many, we expect we'll see a lot more of the participation, as you see in, you know, the latest week that they have data for is the October 17th. So we don't see a great number of increase in tests, but we expect that will increase as we've offered now the rapid test at that site as of last Wednesday. So we should see some increases of residents. We, again, want to state that the North Dakota testing site is overwhelmed with not only just their North Dakota folks, but they want to really limit the number of Minnesota residents going over to their site. They just are overwhelmed. They don't have enough manpower to manage all of that. So they're really encouraging, and we are really encouraging people to take advantage of that rapid test at the Vault site. And you can also get the saliva PCR test there as well.
Thank you.